Well, hello again, fellow students. This is Dr. Brent with another edition of the RSV Miniseries from Dr. Brent and Coco Season 4. I'm here with my coworkers. We are currently untangling Christmas lights, everybody's favorite holiday activity. 'Tis the season, right? Um, they're not being very helpful, so I think we'll just go ahead and get into today's topic because um, we'll get that out of the way because then we can spend the rest of our day on this mess. So today's an important topic to review because it's all about warning signs. So let's jump right in as Coco jumps right down. Bronchiolitis, as we've discussed, is almost always annoying, but sometimes it can progress into something that is actually dangerous. How do you know the difference, though? Well, it's important to go over the symptoms and put them into two main categories, ones that are worrisome and ones that are not. That way, it helps you decide when it's fine to stay home and when you need to bring the baby in. You bring the baby in? You want help? Soka, do you want to bring the baby in? Are you a baby? She doesn't want to go in. Anyway, in this video, we'll go over the signs and symptoms that should cause concern. In a future video, next video actually, we'll go over ones that kind of aren't. So first symptom that's concerning, and the main one, respiratory distress. Now that's a pretty vague term, so let's lock it down, shall we? Now, every kid with bronchiolitis is going to breathe differently than normal, differently than they normally do, different than other kids. They sound gross because of their congestion, and they usually cough a lot. Those things are expected. Those things aren't concerning. What is concerning is when they're actually struggling to breathe. This includes tachypnea, or fast breathing. Normal babies can breathe very irregularly, and all babies breathe differently than adults do. If you have to sit and stare at your baby's breathing to convince yourself that something isn't right, that actually means that it's probably normal because you're working too hard to convince yourself that it's something abnormal. If your baby is in respiratory distress, it should be very clear that something's not right. If you watch a clock with a second hand and count your baby's breaths for 1 minute, a normal newborn will breathe 24 to 38 times on average per minute. By age 1 to 3, that normal range is 22 to 30 breaths per minute. If they're breathing faster than that, look for other signs like our next one, retractions. Normally, we're not aware of our own breathing unless something's wrong or we're meditating and we're told to be aware of our breath. Or like me, if I just walk up one flight of steps and have to take a break, or else everyone around me will notice that I'm struggling for my life. But I digress. Breathing is usually smooth in and out. However, when our body senses that we aren't getting enough oxygen, one way that our chest will respond is by using extra voluntary and involuntary muscles to move air. We call these accessory muscles, and they're located between our ribs, just under our last rib, and between the top of our rib cage and our neck. If you see the skin in these areas sinking in with each of your baby's breaths as they breathe in and out, these are called retractions. If the baby is breathing fast and has retractions, that probably means you need to bring the baby in to be seen. Other signs of respiratory distress include things like grunting and nasal flaring. Sometimes babies randomly make strange noises when breathing, but not usually with every breath. Sometimes babies can flare their nostrils on purpose, but not usually with each breath. If they do either of these things with each breath and they have the two other symptoms I mentioned, tachypnea and retractions, then I would advise you to take your baby in now. So grunting is kind of like, like that. Sorry, I know that's probably going to come back to bite me in the blubber because somebody's going to make fun of me for making that noise. But that's how I demonstrate it to parents in the hospital. The respiratory symptoms are usually the most concerning and the most obvious symptoms to watch for. However, I should mention a few more just to round things out. Cyanosis is a blue discoloration of the skin that happens when someone has a lack of oxygen. Newborns can get this normally in the hands and the feet. It's called acrocyanosis. But no one should have cyanosis in the middle of the body, like the face or the trunk. In addition, if a baby is refusing all feeds or you're worried about dehydration, that's another reason to bring the baby in to be seen by a medical provider. Now, all of these symptoms sound scary, But the good news is that almost every parent has this built-in red flag detector. If you're a parent, you likely have one, even if you don't know it. Now, no two kids are alike, and no two parents are alike. So different people are comfortable with different things. However, you should always listen to your red flag detector as a parent. When your red flag goes up, heed that warning and come in. We have two jobs at that point. We either help make you comfortable with that thing that's in front of you, that symptom that you're seeing, and explain it to you and help you be comfortable, or we take care of it. We treat that baby. Now, next time, we will go over some less concerning symptoms that may seem worrisome, but don't really worry us medically. I bet you'll be surprised by the list, but we'll see how it goes. Can you think of any symptoms that worry you, but weren't included in my list today? Well, put them in the comments. We'll go over them. Maybe we'll cover them next time because maybe there's something that's actually not concerning, but you'll have to tune in. But feel free to throw them in the comments. We'll talk about them some more. That's all for now. Until next time, get to checking those Christmas lights, you animals. My day's kind of going to be cut out for me. So send help. See you next time.